Hey guys, Doc here. Welcome to Boondock Medicine for another video. Can't sleep? Having problems sleeping? You may have insomnia. The main cause of insomnia is psychological stress and the anxiety that arises from it. Other culprits include caffeine and other stimulants before bedtime. Insomnia is one condition that is better treated with herbs than with drugs because most herbs have fewer side effects than pharmaceuticals. Their effects range from mild relaxants to very effective sleep aids and can be taken internally or used topically as a bath and essential oils. Okay, if you're having trouble sleeping, you have to prep yourself for sleep, okay, and try to relax. But to prepare yourself for sleep, you have to eliminate the stimulants. Eliminate the stimulants. Stop taking coffee, tea, caffeinated sodas, chocolate, and sugar-laden desserts 6 hours before bed. That's right, 6 hours before bed. Avoid alcohol and tobacco 2 hours before bed, okay? Everybody thinks you can drink alcohol and that'll help you sleep. It doesn't. It's a depressant, all right, but it doesn't help you sleep. 2 hours before bed, zip on the alcohol and tobacco, especially the tobacco. Check your medications. Many pharmaceuticals interfere with sleep. Ask your doctor if any prescription drugs that you're taking are keeping you up, and they may. End your day with relaxing rituals. Try yoga. Sounds silly, but try yoga. A warm bath is good. Sex, there you go. Light reading, massage, or meditation. Meditation is good too. Let's talk about some supplements you can take for your insomnia. Calcium, 100 to 500 milligrams per day. Chromium, 200 micromilligrams twice a day. Copper, you can take 2 milligrams per day. Remember, the metals you can't take a whole lot of, so that's 2 milligrams per day. Magnesium, 100 to 300 milligrams per day. I take it. Another good supplement for magnesium, to take magnesium, is if you have leg cramps or any kind of leg problems while you're sleeping. 100 to 300 milligrams per day of magnesium will cut that out. I have many patients that has completely stopped any cramping that you get when you're in bed at night. Vitamin B complex, 1 capsule in the AM. That's it. Remember, with vitamin B, you got to take it with, and B12, you got to take it with food. Vitamin B1, 150 to 600 milligrams per day. Vitamin E, 200 400 international units per day. And zinc, 25 milligrams per day. Some of the herbal remedies are very, very good. Valerian is my favorite. Valerian is the most studied herbal sleep aid, and unlike the benzodiazepines, valerian puts you to sleep but doesn't make you groggy in the morning. Benzodiazepines, which are typically given by your doctor to help you sleep, will make you groggy like you have a hangover. They interact badly with they don't interact badly with alcohol or lead to addiction. Valerian is time-tested and will not only help you fall asleep faster, but will improve your sleep quality, your REM sleep. Okay, valerian, remember that. Valerian. If you have problems sleeping, try that first. Okay, the typical dosage is 30 to 45 minutes before bedtime. Take 150 to 300 milligram capsule, and that's pretty much standardized. There is a caution here. Valerian is not addictive, but some people develop a psychological dependence for it. So watch out for that. For a very small percentage of people, this herb produces stimulation rather than a sedation effect. Discontinue this if this occurs. Remember, everybody's different, folks. What works for me may not work for you. Kava kava. When insomnia results from anxiety, this herb is very effective. Studies suggest that kava kava promotes sleep by acting on the brain's emotion centers by relaxing its muscles. Take kava kava about 1 hour before bed. The typical dose is 400 to 500 milligrams or 20 to 30 drops of tincture in water. Don't take this herb while pregnant or nursing or in combination with alcohol or other sedatives. That's kava kava. You can look that up if you like. Skullcap, functioning as both nerve tonic as gentle sedative. Skullcap has been used for centuries for anxiety and insomnia. The typical dose is 1 to 2 tablespoons of the dried herb in a cup of hot water for 10 minutes, or 20 to 40 drops of the tincture in water. All right. Cannabinoids. If your state's still not in the dark ages, you may choose to use pot. Known to relax and heal, CBD has been around for ages and in many places easily procured. Some places not so. Typical dose, I recommend an 8-to-1 full spectrum tincture. This is 80% CBD and 1% THC. So you're not going to get high, but it is going to help you sleep. Use the included eyedropper and dispense 1 to 2 milligrams underneath your tongue. This is a tincture. 1 hour before bedtime, and you will be relaxed, not high. A word about melatonin. Everybody wants to talk about melatonin for sleep. The results of studies using melatonin to treat insomnia are inconclusive. They just are. Anybody tells you they're not, they're lying to you. Because melatonin production requires the amino acid tryptophan, a safer course might be to eat plenty of tryptophan-rich foods, such as turkey, that's a great one, fish, beef, and beans. Although no serious side effects have surfaced, most experts consider this hormone experimental. Melatonin is experimental. Do not let them experiment on you. Avoid melatonin if you're trying to get pregnant or already pregnant or have an autoimmune disease. Children and adolescents should not take this hormone. Okay? So, if you want to take tryptophan, eat a lot of turkey. You know, after a turkey dinner, after Thanksgiving, you feel tired. It's not the cranberry sauce, okay? It is the tryptophan in the turkey. Alrighty, okay, all right. Hey, if you like what we're doing, subscribe. This is Doc signing off. Stay tuned for another Boondock Medicine video. Thanks very much. Bye-bye.